Good afternoon. I want to start off by saying thank you to the International Turkish Gastric Cancer Congress for the opportunity to present here today. My name is Atusa Kiabani, and I'm a medical student from the University of Birmingham in the UK, and I'm working in collaboration with the Department of Upper GI Surgery at the Queen Elizabeth Hospital. So our talk today comprises of the surgical and pathological outcomes in patients with a CDH1 mutation undergoing total gastrectomy. The CDH1 gene encodes the transmembrane protein E-cadherin, which plays a role in cell-to-cell adhesion. CDH1 positive patients have an increased 60 to 80% increased lifetime risk of developing diffuse gastric cancer. The 2020 guidelines by the International Gastric Cancer Linkage Consortium, also known as the IGCLC, have developed a set of genetic testing criteria demonstrated on the left. And their recommendation is that patients that are found to have a mutation in the CDH1 gene should undergo a prophylactic total gastrectomy. The aims of our study, therefore, was to characterize the postoperative outcomes for patients with a CDH1 mutation, and also to highlight any important areas of consideration for those that are newly found to be carriers and are considering a prophylactic total gastrectomy. We began by conducting a systematic literature search, having a look for studies reporting endoscopic surveillance and surgical and pathological outcomes for any patient with a CDH1 mutation undergoing total gastrectomy. And this provided us with a total of 33 studies. So of the 33 studies, a total of 1,013 patients were identified, 941 of which harbored a CDH1 mutation. Endoscopy and outcomes data were reported for 678 of these patients. And as you can see, 184 patients had cancer detected on endoscopy. And of these patients, 88% went on to have a total gastrectomy. The remaining 12% of these patients either deferred surgery or were lost to follow-up. A total of 494 patients did not have cancer detected on endoscopy, and 32% of these patients either chose to defer surgery or again were lost to follow-up. 68% of the patients did go on to have a total gastrectomy, however, and as you can see, 84% of the patients who did not initially have cancer on endoscopy were found to have cancer following the gastrectomy when looking at histology samples. The 16% of patients that did not have cancer detected following their gastrectomy are considered to be our true prophylactic gastrectomy cohort. We went on to have a look at endoscopy following this, and 16 studies in total reported the protocols used, which is demonstrated on the left. But in general, across all of the studies, data about the optimal timing and the number of endoscopies is lacking. We did find, however, that of the patients that chose to defer surgery, the most prevalent reason for this was because they were opting in for endoscopic surveillance instead. Moving on to looking at pathology, pathology outcomes were reported for 533 patients across 27 studies. And what we found is that the most prevalent pathological finding is PT1 disease with 85%. And although it's not shown here on the left, we did find that the majority of the patients with advanced disease, i.e. those that have a stage 3 or stage 4 cancer, were found to be symptomatic prior to undergoing surgery. Finally, having a look at complications, 20 studies reported a total of 163 complications for 405 patients. Only 8 studies reported whether these complications were early, i.e. less than 30 days, or late, more than 30 days. And as you can see here on the left, the most prevalent complications that were reported were anastomotic strictures, anastomotic leaks, wound infections, and pulmonary complications. There was one postoperative mortality reported due to multi-organ failure, and this was in a patient with prior comorbidities. So to conclude, our study suggests that a prophylactic total gastrectomy should be considered in patients with a CDH1 mutation, regardless of their initial endoscopic findings. And this is something that is also recommended by the IGCLC. We also conclude that adequate counseling needs to be provided with careful consideration of the associated morbidity for any patient who is found to have a CDH1 mutation and is considering undergoing a prophylactic total gastrectomy. And finally, we conclude that standardization of outcomes reporting is required in any study that is having a look at CDH1 mutations and the outcomes of a total gastrectomy. So I would like to finish off by mentioning some acknowledgements and say thank you to Mr. Ewan Griffiths, Mr. Sivish Kamarajar, and also Dr. Mason Liu. Thank you very much for listening, and I'd be more than happy to take any questions.